And today we are absolutely delighted to welcome you to the HCC webinar series on childhood obesity prevention in the Caribbean. This series supports the HCC's Civil Society Action Plan 2017 to 2021, titled Preventing Childhood Obesity in the Caribbean. And the series is intended to build the capacity of civil society organizations and other stakeholders advocating for and implementing childhood obesity prevention policies in the Caribbean. This second webinar, entitled Pushing and Pulling the Caribbean Experience Moving Towards Front of Package Nutrition Labels, examines regional multi-stakeholder efforts, experiences, and perspectives related to the promotion of a CARICOM front of package nutrition warning label. Colleagues and listeners, there's a crisis of overweight and obesity in the Caribbean, with some countries experiencing astounding levels of adult obesity, approaching 70%, and 1 in every 3 children being overweight or obese. This dangerous epidemic is fueled by a dramatic shift in diets towards processed and ultra-processed, energy-dense and nutrient-poor foods, most of which the region imports. The 2019 Lancet report highlighted that unhealthy diets pose a greater risk to morbidity and mortality than does unsafe sex and alcohol, drug, and tobacco use combined. It is clear then that urgent action is needed globally and in our region to dramatically shift diets away from unhealthy foods towards what we so often refer to as real food. The World Health Organization, PAHO, the Caribbean Public Health Agency, and we in the HCC, we all recommend a suite of policy interventions to tackle childhood obesity, and these include the provision of mandatory front-of-package warning labels. There is a growing body of evidence which is clear and unambiguous. Warning labels assist consumers in making informed decisions about the nutritional content of prepackaged foods and beverages. And recent unpublished data show an almost 25% reduction in purchases of unhealthy foods post the introduction of front-of-package labels. Moreover, front-of-package labels is an essential element of any comprehensive package of policy interventions to combat childhood obesity. It defines the products which should be taxed to discourage consumption. It defines the products which cannot be marketed to children in various settings. And it finally defines the products which should not be accessible to children in schools. You know, it must be emphasized that there is a clear mandate on this matter from CARICOM heads of government, who at their 39th meeting in July 2018 specifically called for the implementation of policies geared to preventing childhood obesity, including front-of-package labeling. And so there is a directive from the highest levels in the Caribbean to prioritize this policy intervention. The CARICOM region is currently engaged in an extensive consultation process around the adoption of mandatory front-of-package nutrition labels. We in the HCC hope that this seminar will contribute to greater awareness and support for the introduction of mandatory warning labels in the region by all sectors of society, whether they be the general public, policymakers, or the private sector. We look and we encourage your support. We are absolutely delighted to present today an excellent panel of speakers who will provide background on the nutrition labels and make the case for the high-in front-of-pack warning label. We will hear about the regional process around the adoption of the revised standards and the government and civil society experiences in advocating for front-of-pack nutrition labels. We will learn about global experiences, including that of Canada and Uruguay. And finally, we will explore practical implications of the proposed scheme, including the impact on regional trade. We will discuss the next steps to move us closer to a regional front-of-package label standard and ultimately national regulation. And so with those deliberately brief opening remarks, now to some housekeeping matters. But before we get started, therefore, I'd like to share some items. First of all listeners, your mics are all muted. We will provide a series of presentations, and at the end of all of the presentations, there will be a question and answer session. We encourage you during the webinar to submit your questions in the chat box at any time. Our team here at the HCC, we will be collating questions which will then be directed to the appropriate speakers during the Q&A at the end. And so let us get on in the webinar. Your program would have shown that our first speaker is Dr. Fabio da Silva Gomez of PAHO. It would appear that Fabio is not yet online, and therefore we will commence with Fulgence Simpri of CROSQ. Simpri will speak to us on the issues as in your... Yes, so here we are. So Dr. Simpri is Technical Officer of Standards at the CARICOM Regional Organisation for Standards and Quality, otherwise known as CROSQ. Dr. Simpri will be providing an update on the regional process today and the key milestones in the coming months. Dr. Simpri, over to you.
Thank you, Dr. Hassel. Just a correction, it's not Dr. Simpri, just Mr. Simpri for now. Yeah, and I'm presenting on the status of the revision of the standard labeling of prepackaged foods, and in that standard we're including front of package labeling. A brief synopsis in terms of a regional technical subcommittee was established in April of 2018, that's last year. Normally the standards development process begins with the submission of a new work item proposal. In this case, it was realized that the prepackaged foods labeling standard was due for revision, because we try to revise standards every 5 years. And so the Technical Management Committee, which is a committee of standards officers, regional officers, right, every bureau being represented, took the decision that we could do a systematic review of the labeling of prepackaged foods, and then we would include the front of package labeling in this standard. That was the proposal. That was presented to the CROSQ Council in its meeting in Barbados in April of 2018, where they unanimously approved the systematic review of the standard. Then, upon approving the proposal, member states had to indicate whether they would like to actively participate on the technical committee, which would be responsible for the revision of the standard. We got 11 member states indicating interest, right? 4 states just felt that they would just participate by commenting on the draft documents presented. The representatives on the technical subcommittee included industry personnel, it included health personnel, as well as regulators and general interest persons. The representatives would have been nominated by the various bureaus of national standards bureaus in the member states. The committee is currently being chaired by Barbados, all right, an industry person, representative. But then in chairing the committee, the person who is chairing removes themselves from the normal role. Yeah. And so all they do is to give guidance to the committee in their deliberations on the standard. So they act in a truly regional mode. Right. The first chair elected was from Jamaica. Unfortunately, that chair resigned for whatever reason or the other, and then a second chair was appointed by the committee in Barbados. Principally, the committee operates online, right? So meetings are held via the GoToMeeting platform facilitated by the CROSQ Secretariat. And since then, we have also tried to have face-to-face meetings, because which is important to have that interaction to get to arrive at this with certain decisions. In terms of the content of the standard, we have the term, the scope, they have the certain terms and definitions outlined. They have the general principles of food labeling. Then they have the labeling requirements, general and specific, and then additional labeling requirements such as foods for special dietary uses, organically produced foods, and others. And we have the front of package labeling requirements. The standard was updated, right, using the requirements of the 2018 version of the Codex Alimentarius for food labeling. So the first decision was to update the standard, right, in accordance with the Codex standard on food labeling. And then we included the front of package labeling, and it was proposed that the warning system, which is similar to what is being used by Chile, right, and other member states. In fact, Canada is moving in that direction as well. And because it was felt that the warning label was the most suitable system to use to achieve the policy objective of CARICOM, in that you would know that the objective is to cause a reduction in NCDs as well as obesity generally, and specifically obesity in children, right? So it was felt that that would have been the most appropriate system to cause, right, to achieve that objective as stated by the heads in the declaration, the Port of Spain Declaration. The update up to now, a working draft was presented to the regional technical committee members. That working draft was reviewed by them and comments received. They will also what was done is that normally in standards development, good practice dictates that if you're participating in a regional standard or an international standard development process, that you set up what we call a national mirror committee. The national mirror committees are supposed to comprise stakeholders which are directly affected by the particular standard. So you have a wide cross section of stakeholders, right, being represented on a national mirror committee. That national mirror committee follows the development of that particular standard, and they're the ones that's supposed to be coming up, of course, upon the guidance, with the guidance of a National Standards Bureau officer, to come up with national positions. So all comments that are received on any standard that is being developed are reviewed by the National Mirror Committee, and they decide, right, which comments should be proffered as the national comments of the member state, right? Now that is important, because you do, when the standard is related, right, to the wider public, you do have comments coming from various quarters on the same article, right, in a particular standard. And so you don't want to have varying comments coming as national comments, because then which which comment really truly represents that of the member state. And so that is one of the things that the National Merit Committee is supposed to resolve. So you don't have conflicting comments coming from the same member state on the same section or clause of a standard. And so that is exactly what they do. So national merit committees were supposed to be set up, and the other factor about national merit committees, they're supposed to have balanced representation. So if you have a certain number of one stakeholder grouping, when you total all the persons represented, it should have some balance in the representation of the various stakeholder groupings. So the working draft was shared with those national merit committees to get the initial views on it and make comments. At that time, we received something like 66 pages of comments, which we disposed of online, and we had a consensus meeting in Guyana to deal specifically to agree on the draft that would go forward as a draft CARICOM regional standard. Right, that meeting was held in Guyana somewhere in September 2018, and thereafter the working draft was upgraded to a draft CARICOM regional standard and sent to member states for circulation, wide circulation to other stakeholders. Normally, in accordance with WTO practices, good standardization practice, the standard would be circulated for no less than 60 working days, right? 60 days for circulation at the regional level, both at nationally. However, because of the importance of this standard in moving forward, initially the standard was circulated for 30 days, for 60 days, sorry, for 90 days, my apologies. So I circulated the standard from October, and responses were supposed, the deadline for responses was supposed to have been January 11th, 2019. However, member states, again, because of their processes, they requested extension in terms of the deadline for submission of comments, and that went on for a while until we had an absolute cutoff date of March 31st, 2019. That's when we decided, okay, let us get all the comments. There were about 114 pages of comments coming from 14 member states. During that period of time, member states held national consultations on the standard, presenting the standard to key stakeholders and anybody of interest, right? We invited to those consultations to ensure that they have a wide outreach, of persons out there. Okay, so like I said, 14 member states submitted comments. Then we engage a consultant to assist with the disposition of comments, of these comments. The disposition of the comments commenced with two online meetings. Then we had a second face-to-face meeting to see if we could have tried to come to consensus and completion of the comments. That did not happen because the number of comments that were received, and so we are at the point where the comments are still being addressed. Hopefully, we intend to complete those comments online by at least the third week of July. Yeah, and next we have, since the face-to-face meeting, we have had 2 online meetings, and we're now going to be looking at another online meeting happening on the 25th, which is next week Tuesday, and move forward to try to complete. A third face-to-face meeting is proposed to come to have a consensus on, when we finish all those comments, to agree this is the document we want as the final document. What happens normally is that, should in case, upon disposition of all the comments, should in case we have a significantly different standard, in other words, there are great changes in the standard, we will circulate the standard for another round of comments. But based on what has happened so far, I'm thinking that that might not be necessary, although we still doing disposition of technical comments. So it all depends. We have had some challenges during the development of the standard, right? Of course, the availability of member states, of members to attend meetings, online meetings, as well as to be able to pay the necessary attention that is needed for disposition of comments. We're hoping that it will not persist, and then we'll be able to have a timely completion of the comments disposition, which is the major factor. Of course, I would have mentioned the fact that we would like to have a third face-to-face meeting, a consensus meeting, and the availability of funds to do that, right, might be a challenge. Although hopefully, based on a meeting that I attended over the past 3 days, it appears that we might be successful in getting some funding, right? And there's also a challenge where a member is proposing to shift the front of package label from the prepackaged food standard to the nutritional labeling standard, right? And so member states, food and national merit committees are presenting national positions in that regard. We'll see how this go by Tuesday next week. All right. The next steps is to complete the composition of comments, like I said, by July 23rd. Have that face-to-face consensus meeting by the end of July 2019. Update the CARICOM regional standard to a final draft CARICOM regional standard, where the standard will be submitted to member states for acceptance. And I'm hoping to give at least 10 weeks, if not 12, for that to happen. During this time, the process of the development of the standard will be presented to the Technical Management Committee, which I would have indicated would have been the technical officers from the various NSBs, to look at the process. In other words, they validate the process for attendance, for development, to ensure that the process was followed adequately. Then that draft standard represented to the CROSQ Council, and then submission to quoted. Hopefully, we'll target it either November 2019 or latest April 2020 for approval for submission to the quoted. Yeah. Let me just indicate what happens after a regional standard is approved. Normally, it goes to the member states, and according to the revised Treaty of Chaguaramas, member states are supposed to adopt whatever decisions that come from quoted. And so we're saying that they're supposed to adopt this nationally. The standard or the requirements of the standard are asked to be made mandatory. So they need to put in the necessary administrative provisions to give legal effect to mandatory implementation. We're hoping that that will be done using good regulatory practices in that regard, and the necessary education and awareness campaign be developed and implemented in trying to implement the standard. I'm recommending, because of the challenges that we have received thus far, that at the highest level, the decision-making level, that quoted and COSHOD is the Council for Human and Social Development, right? Health and Social Development. To meet, quoted is the Council of Trade and Economic Development Ministers, so that the trade ministers meet with the health and social, human resource ministers to be able to understand the reasons for the FOPL. Then you have a special engagement with the private sector at the member states level, right? In support of the high-in warning label. I would have talked about the consensus meeting already. Garner support for the initiative among consumers at the national level for an extensive public education awareness campaign, and the meeting to have special meetings at the national level between health and commerce and trade ministers, so that everybody is on board. And basically, that in a nutshell is where we are in terms of the process and recommendations moving forward. I thank you.
So thank you very much, Fulgence, for that excellent, that really outstanding and very comprehensive review of the regional process today, the key milestones and the way forward. Our next speaker is Dr. Fabio da Silva Gomez, who is Regional Advisor in Nutrition at PAHO in Washington, D.C. We are extremely pleased to have PAHO presenting today. PAHO is in fact a very strong partner of the HCC, and Dr. Gomez today will provide a general overview of nutrition warning labels, justification for the warning labels, and he'll share the learnings from the Canadian experience, which I'm sure will be very useful to us in the region as we continue to navigate this process. And though we're running a few minutes over our allotted time, I look forward, and I'm sure everyone looks forward to the presentation from Dr. Gomez.
Thank you very much, Sir Trevor, for the introduction. Everyone can hear me? Can you hear me?
Fabio, yes, we can hear you loud and clear.
Thank you very much. And thank you, Fulgence, and congratulations for your work and for the work that CROSQ is moving forward. So, as
thank you, Pao. Thank you.
As Sir Trevor mentioned, I'll go through the major evidence that supports the need for countries to move on with the front of pack labeling, and how countries are taking their decisions, and that's also explains some of the processes and the basis for the CROSQ proposal, as well as other countries that have taken that forward and that have adopted that systems or are in process of developing. So it's the first thing is to make understand that the nutrition facts, they're a very important tool and an essential tool to be presented and offered to the consumers, but it's still very hard for consumers to use that for a quick and informed decision. This, even if you take the examples of how many forms or designs or manuals have been developed to try to make people understand the nutrition facts, this is already an evidence that it is limited in terms of the timing and the amount of information that people would need to address and to assess and know beforehand, so they can take the decision. For instance, in the right hand side, you see a scheme trying to explain people how to decipher the nutrition facts, and there's a lot of information they should know beforehand about calories, total fat, cholesterol, sodium, dietary fiber. They need to follow and check different items, see what is some of them, what are the portion size, or they have to check calories. Then they have to check what number of nutrients they should limit, then the ones they had to get enough. So it's if you just when you finish reading this, or you finish going through this process, your time to take the decision, the real time you take to take a decision at the supermarket has passed already. So this is another example how time-consuming and cognitive effort it requires for a consumer to take a decision and to be informed by nutrition facts. That means that it's important to have those information available, but that's not what usually will help consumers take a decision quick and easy. And if we take the evidence from consumer research and marketing research, and this is 2 Nobel Prizes on economic sciences from 2002, and the basis of their research demonstrated that consumers do not engage in extended cognitive effort in purchasing situations. So they minimize both the error and the effort. That means they do not spend a great deal of time and effort when taking the decision. So if we have a system that requires them a lot of cognitive effort or time, they will ignore that information and they will use more simple heuristics or simple information to take that decision. So the first thing when countries are deciding for the front of pack labeling system, if they were to look at all the systems that are out there to decide what is available, that will be an endless task, and it will be extremely inefficient, because we have, for instance, data from Canada that just in Canada there's more than 200 front of pack labeling systems applied in the market between the voluntary front of pack labeling system. If you sum up with other front of labeling systems that are out there in the world, this is going to be thousands of front of pack labeling systems available. So it's not efficient for the country to go out and start comparing every and each system. What the first thing they should do, and what countries are looking at doing, is to focus on what is the purpose of that front of pack labeling, what the country needs to achieve and wants to achieve. And in the Caribbean, and as well as in the Americas and other parts of the world, if you look at the major burden of diseases, what is actually causing most of the deaths and most of the loss of healthy life years are the high fasting plasma glucose, high blood pressure, and overweight, obesity. And this example here demonstrate how many millions of years in 1 year the Caribbean lost just because of these three main risk factors, which are associated with the consumption of products high in sugar, sodium, and saturated fats, and trans fat. That means the purpose of the front of pack labeling system in these countries have been focused on informing the population if products have a high content on these critical nutrients. But one of the things, the second thing, as we get the purpose defined, so if our purpose now is to inform quickly and easy about the products that are high in these nutrients that are killing most of the population, now we need to check the performance of different systems that could address, that could inform that, bring that information to consumers. And there are some systems that could bring that information of high in, but they mixture some of the information of high in with other informations. And when you check the performance, they would perform worse. And there's several reasons. So if you take the example of the traffic light systems, you would see that the first thing is that they offer a conflicting valence, which means that in the same product, you would have the product being recognized as something as healthier, less healthier, and least healthier at the same time, and this will make confusion of consumers. The other thing is that the red-green blindness is one of the most common form of color blindness, which would restrict some of the information for consumers. And also you have distortions. If you look at the left-hand side, you see a sugary drink that demonstrates that it's red for sugars, but it's green for all the other nutrients, which would be stimulating the consumption of a product that needs to be discouraged as recommended. So this is a kind of system that would bring one information on what could be, for instance, high in such nutrients, but it brings other information that creates confusion, and in this it makes it more difficult for the consumers to decide. The other thing is that if you have 4 nutrients and you have 3 possibilities of each nutrient to be taken, for instance, each of these nutrients could be green, yellow, or red, that would give you 81 possibilities of comparisons in the market if the products, depending on the concentration and the content of those products. And that will make the task of the consumer much, much more difficult. So the other thing, and what the research has demonstrated in comparing the systems, refers to how much and how better they promote and understanding, and they change the purchase intention and the purchase decision of consumers. So this study done in Canada, UK, and the US, using the high-in approach with different designs, has demonstrated that the high-in, the ones that are shown on the top right hand side, they have increased the understanding of the consumers about the products that that have excessive amount of saturated fats and sugars, for instance, compared to not having any system or having the other systems, for instance. This randomized controlled experiment took place in Brazil, and it compared, if you see at time 1, none of the products had any front of pack labeling system. At time 2, we had 2 different systems, a warning system that says high in sugar or saturated fats, other nutrients, and you have on time 2, on the bottom right, you have a traffic light system with the colors, a GDA, a colored GDA. So, and if you see the results in terms of understanding, you see that at time 2, the square is the traffic light system, and it didn't change the understanding about whether the product contained levels higher than the recommended for a healthy diet. But when you see the high-end system, it did significantly increase the understanding of the consumers. When we look at the same study, compare the purchase intention, and you see that there's a significant reduction comparing the square, which is the traffic light system at time 2, to the triangle at time 2, 3.9 to 2.6. That was the average scourge of the likelihood of people to choose a different brand or choose a different product if it had the warning system, for instance. It also changes purchase decision, and this is the research coming out from Chile, where 91.6% of the population in the study did indicated that the warning systems applied there influenced their decision making. So they choose products with less warnings, they don't buy products with warnings, or they purchase less than they would if the products had no warnings. So it does influence their purchase decision. One of the things the second thing that is important for countries to consider is what and how they're going to decide which products are high in. And for that purpose, PAHO also developed the nutrient profile model, which is based on the sugar, sodium, total fat, and saturated fat and trans fat intake for adults and children. So the recommendation of WHO is that these nutrients should not go over 10% of the energy from free sugars, 30% from total fat, 10% of saturated fat, and 1% from trans fat. That means if a product has more than this amount of energy from these nutrients, it will unbalance the diet of the population and of any individual of any age group or in any amount, because we're speaking about proportions. So the more products you have with above these proportions, the more you're going to be likely to unbalance your diet beyond the recommended values, because this is exactly the same amount of goals that the same goals that are defined by the WHO recommended intake goals. So for that reason, we now have that's why most of the countries in the region and are seeking these systems, because it meets the purpose of identifying quickly, helping consumers identifying very quickly and easy the amount of if products have an excessive amount of critical nutrients. So on the right hand side, you see you see the system in Uruguay, Luis is going to speak about in a moment. You see Chilean and the Peruvian system, and they're all already adopted, and some of them still to be started to be implemented. But in some countries, you can already see some of the products out of implemented. So in Chile, it's been fully implemented, and this year is the third thresholds coming into place. So you can see not only the high end in all the products there have an excessive amount of nutrients, and also the removal of cartoon characters. But on the left-hand side, you can also see the products they're advancement of the implementation. They've already adopted and included the high-in signs in Peru. That's the left side, and that's the first product already implementing the system, and this is Olive in Uruguay. Luis is going to speak about it. So it's moving forward the implementation in all these 3 countries that published and approved already. And then very briefly to close the process in which Canada is also developing. So the process in Canada also made clear that their purpose is to inform the population about the products that are high in these critical nutrients. The discussion was more about the consultation of which symbols they would use, but the approach was being decided. But they also were considering the location of the symbol, which is also something that the CROSQ standard is also indicating as well. The symbol size and restriction of other prominence, placement and prominence of other health-related information that could harm that specific information. So the consultation is being closed already. The same way the CROSQ run the consultations, they also had a consultation, received a lot of submissions and analyzed them. Again, as I mentioned, they're focused on helping the consumers identify foods that are high in critical nutrients, and they open the possibility for people to send their opinion about the different designs of the symbol to do that. And this is very critically and closely linked to the major health risks they have and the major burden of disease they have. So all the other countries is just one example. All the other countries have just followed the similar approach, the same way CROSQ is following, just because this is where the major burden of disease is. So just my 2 final slides is 2 consumer research that has been done in Canada to confirm the one is in a realistic setting. So they mounted a full supermarket, and they enable consumers to go through and compare the different high-end front-of-pack labeling systems, and they confirmed that it discouraged the purchase and consumption of foods high in nutrients of public health concern. They also checked if the high-end system would matter depending on the size, the placement of other claims, and the mandatory attribution of Health Canada, and all these also help them informing the consumers and changing their decision to a more successful decision. Thank you very much.
So thanks very much, Fabio. That's really excellent, and certainly gives us a very good overview of the challenges and the importance of this particular initiative. It's now my pleasure to introduce our next speaker, Dr. Arthur Phillips, who is Senior Medical Officer for Health, Non-Communicable Diseases in the Ministry of Health and Wellness, Barbados. Dr. Phillips will share the Barbados Ministry of Health and Wellness experiences in advancing front-of-package labeling in Barbados. Dr. Arthur Phillips, please go ahead.
Good morning, and thank you, Prof. Thank you to HCC for hosting this webinar and for allowing us to share a glimpse of our experience and our thoughts on the issue of front-of-package labeling. Certainly, we see front-of-package warning labeling as having an important role to play in improving awareness and in supporting decision-making and ultimately impacting health. In Barbados, we are faced with a large and increasing burden of non-communicable diseases, and this translates into tens of thousands of persons living with high blood pressure, diabetes, and other NCDs, and over 1,000 new cases of ischemic heart disease and stroke being hospitalized every year. The statistics translate into impact, which goes beyond health impact in terms of years of life lost and impaired health, to issues around reduced productivity and healthcare costs. And the burden of cardiovascular disease and diabetes, just two of our NCDs, has been conservatively estimated at 2.6 percentage points of GDP in 2015. And this is just government involvement and some limited social impacts. So in our view, the NCD challenge requires multiple approaches, and it requires engagement of all sectors, including government. And poor diet has been identified as an important contributor to the NCD burden, including work that's been done in this region looking at the impact of poor diet on overweight, obesity, and the wider NCD challenge that we're facing. There have been responses in the wider context. There's WHO NCD guidance that includes front of package labeling, and these official WHO documents have been adopted by member states at World Health Assembly. The CARICOM heads, as will have been mentioned by previous speakers, would have endorsed front of package labeling as part of a 6-point policy approach to addressing NCDs, and they would have done this including at the United Nations high-level meeting in September of 2018. And Codex, as a standard-setting body for food safety and nutrition issues, would have also indicated that where there's mandatory nutrition labeling, sugar, fat, and salt should be declared. Fortunately, our local context also includes strong support for front of package labeling. This was found by a local reputable polling agency, CADRIS, who found nearly 90% of the general public were in support of the idea of warning front of package labeling. Ministry of Health has been engaged in a process inclusive of looking at the proposed CARICOM draft standard for labeling, including front of package labeling for prepackaged foods. We've been sitting on the National Mirror Committee along with other stakeholders. We've taken part in the National Public Awareness Consultation, and we are sitting on an ad hoc policy committee looking at issues around implementation. What has been important, or one of the things that's been important in terms of the context and the public engagement and advancing things, has been the civil society support. And again, I want to commend HCC and other local NGOs, including Heart and Stroke Foundation, for their support in this effort. Ultimately, the position of the Ministry of Health on the National Mirror Committee and the official position so far of the National Mirror Committee has been that, given the urgency of the NCD problem, given the reality of the challenges around making decisions on nutrition that consumers have, and the challenges that consumers have in terms of the information that's available, the conflicting information, we believe that front of package labeling, warning labeling is important, and we fully endorse the proposed CARICOM standard based on the evidence of effectiveness of this proposed intervention. So we look forward to continuing to partner with the various stakeholders and advancing the discussions and engaging with the public so that decisions on foods can be made in a way that would better contribute to health and the development of Barbados and the region. I thank you.
So
get out of that, Jeremy.
So thanks very much, Dr. Arthur Phillips. We have certainly been having an interesting experience in Barbados. We now go much further afield and to one of our colleagues in Latin America and the Caribbean. And first of all, let me say HCC expresses its appreciation to PAHO for having facilitated the contribution from the next speaker, who is Mr. Luis Galicia, who is the consultant NCD programmatic area of the Ministry of Health in Uruguay. You know, the country of Uruguay is a small one, such as our countries here in the Caribbean. And Uruguay has recently introduced front of package labeling, and Mr. Galicia will be sharing the experiences of that country. Over to you, Luis, if you would begin your presentation.
Thank you very much, Sir Treble, and thank you for the invitation to the HCC. And I send the regards of Dr. Raquel Rosa, our General Director of Health here at the Ministry of Health. So, as Sir Trevor said, our countries share many similarities. We're small countries. Uruguay a little bit bigger than all Caribbean countries, but just 3.5 million inhabitants. And we are surrounded by two giants, Brazil and Argentina, that we also share a regional integration process in Mercosur that also determines many of the technical regulations that are implemented locally, including nutrition labeling. That has been one of the issues and topics relating to these front of package labeling implementation. So I'm just going to talk a little bit of background. That's going to be very quick. We're going to discuss a little bit about the front of package labeling as general policy, and specifically on the Decree 272 of 2018 on front of package labeling. And we're going to discuss some barriers from implementation and challenges that we'll be facing in the last few months. Different to any of the Caribbean countries, we share that high burden of disease coming from dietary risk. 5 of the top 10 risk factors in Uruguay are related to diet, being the second one dietary risks, and that's not different from any other of the countries, not only regionally but globally as well. Specifically talking about overweight and obesity, we've had 2 surveys and 1 study in 1998, and all of them showing a very quick increase in the prevalence of overweight and obesity. As you can see, from 2006 to 2013, that was our last survey, we had an increase of almost 7 percentage points, and all of that is due to increasing obesity. So overweight being steady and obesity increasing very quickly in the past 8 years. That's for adults. And when we talk about young people and children, we see exactly the same situation. You see there are 37% in young adults and 27% in adolescents, 10% in small children. So that's we know that the data is not current. The last survey was in 2013 for adults, 2012 for adolescents that we're going to repeat this year, and 2015 for young children. So we know the situation has worsened since then. Talking a little bit dietary patterns, same thing as in the Caribbean. Not many people consume the recommended amount of fruits and vegetables. Many of them consume very small amounts, as you see in adolescents. 1 of every 5 children 2 to 6 years of age consume sweetened beverages when thirsty, and we have very preliminary data on this same age group. A recent survey and 24 recalls show that over 90% of those children consume either sweetened beverages or sweet cookies or other foods high in sugar, sodium, or fat in the day prior to the survey. So that's a very bad situation. So you see the same things for adolescents when it comes to sweetened beverages and fast food. And this is from the PAHO report of 2015 on the sales of ultra-processed products. And you see that the sugar-sweetened beverages tripled between 1999 and 2013 in Uruguay. You see the blue line with the red arrow being our country. So it's one of the highest countries in increasing the sales of ultra-processed products, and the same for other products that almost doubled from 15 to 25 kilograms per person per year. When it comes, one of the reasons for that is that the affordability of these products has increased at a very high rate, almost 3.5% between 1997 and 2016. So cheaper products available almost everywhere make it easier for people to consume them. So seeing that situation, the Ministry of Health started in this period from 2015 an exercise of planification and accountability. It's the National Health Objectives 2020, and within the strategic objective 1, which is to improve lifestyles, there are 2 that you probably won't be able to see in the screen, but it's to develop a national program for prevention of obesity, overweight and obesity, and increase physical activity, and to stop the increase in the prevalence of overweight and obesity. So from that, the country developed with an intersectoral group a national policy for prevention of overweight and obesity. It has many lines of action, including cultural and behavioral change, breastfeeding and complementary feeding practices in young children, regulation of marketing of breast milk substitutes, dietary guidelines that were updated in 2016, the strengthening of food and physical activity in school environments, and we have a law, the law number 19140 on healthy diets in school from 2013, that is like our framework for that work. The progressive elimination of industrial trans fat, that is another presidential decree just signed in April of last year and will go into force in October of this year. Of course, front of package labeling, the reduction of salt and sugar in processed foods, and a national program for control of overweight and obesity in the national health system. So seeing all that, the president also created a national honorary council of policies for prevention of overweight and obesity in November of last year, and that's what that is our framework for development of all these policies. So specifically on front of package labeling, when the country started working on this policy, the objective was to provide objective information to the population through a simple and accessible tool that allows the identification of packaged food with excessive content of critical nutrients. And the reasons were very well explained by Fabio. The current nutrition facts are not understood by most of the population, and they are not even used, as the studies in Uruguay showed. The scope of the regulations to be focused on nutrients that are associated to the development of obesity and NCDs based on current evidence. So for implementing or development of this policy, the Ministry of Health convened an intersectoral group in 2016. That group discussed, one of the first discussions was to see how to manage the conflicts of interest, and whether to include the industry in the process of development of the regulation, and all the group agreed not to include the industry during the development of the regulation, but only during the public consultation process. As you can see the steps in there, the first part was to review and analyze the evidence, identify the critical nutrients and the threshold to define the excess, and in that instance we used the PAHO nutrient profile model to define those thresholds. We developed a graphic system or analyzed which was the best system for that and for other steps in the process. We use always national evidence. There were more than 21 studies developed, and they are all published in peer-reviewed journals. After that, there was a process to develop the draft decree, and when the draft decree was ready, about June 2017, it was put into national and international public consultation for a period of about 2 months. With the comment, during the public consultation, there were also face-to-face meetings with some particular industries or industrial groups that requested it, so to discuss some of the issues in the regulations. So after those comments and the public consultation, the country decided to flexibilize the criteria on the PAHO nutrient model, and also to increase the time frame for implementation of the regulation. This decree was approved by the cabinet ministers on August 2018, and at the same time a bill was sent to the parliament to make the front of package labeling a law. And after that process, a period was open for implementation. Also, after the decree was approved, it was sent, it was notified to the World Trade Organization, and another consultation process open for about 3 months. So as you can see in this table, you can see it in the center column, the nutrient profile model from PAHO, and how the decree takes those thresholds and adapts them according to the comments received from the industry. So instead of 1 milligram per calorie, it was 8 milligrams per calorie, or 500 milligrams per 100 grams. The sugar threshold was turned into a 20% of the total caloric value, and 3 grams per 100 grams, and the fat was changed to 35. The saturated fat was changed to 12%. As you can see, we didn't use the same wording as Chile in the regulation. They use high in, and we use excess: fat, saturated fat, sodium, and sugar. As I told you before, the trans fat elimination process is ongoing, so we didn't include trans fat in the regulation. And each symbol should be placed in the front of the package, and the size of the symbol according to the area of the front of the package, not the front of the label. So the decree was approved, as I told you, in August 2018. It was incorporated to the National Food Regulation of 1994. It provides 18 months to importers, producers to adapt to the regulation, and it recommends to include all other activities. The importers and producers are responsible for the accuracy and legibility of the label, and the characteristics of the systems are described in the annexes of the decree. So from 31 August, which was when the decree was published in the Gazette, we also developed a manual for application of the decree. There are some ongoing processes for modification of the authorization and registry of food products, and also there was a request for additional information using a ministerial ordinance. We're also in the process of developing guidelines for monitoring and evaluation, and that includes the creation of a baseline of all products or products registered or authorized for commercialization in the country. And the decree will go into full force in March 1st of 2020, but as Fabio shared a few minutes ago, there are at least 2 products that we know that are already carrying the label. So the guidelines for placement and size of labels are thoroughly described in the application manual. The use of claims and other labeling schemes is allowed by the current regulations, so other than the front of package label, they can use the current approved claims described in the Mercosur technical guidelines. All imported and national products have to comply, and in the case of imported products, they can use stickers in the products following the guidelines, of course, for the national products. And we also had some considerations on returnable bottles, such as in sweetened beverages and other products that can show the seal in the bottle cap until March 2023. So we gave an additional 3-year period for those to adapt to the regulation. Some of the challenges that we have, the development of the baseline has been particularly challenged because in here there are 29 departments and all of them have their own registration process. But the Montevideo local government authorizes a little bit over 90% of the products sold in the country. So we're working together with them to develop a baseline of all the products to create good monitoring and evaluation guidelines later. The guidelines for enforcement are done in coordination with those local governments, and we also had a mass communication campaign addressed to general population, not only on a healthy diet, but at the end of it, probably by the end of the year, we'll have more communication on the front of package label itself. And also as I told you, there were 21 studies developed during the development of the regulation, and we're also conducting those in coordination with the University of the Republic, which is our main university in the country. So that's it for me, and I thank also the organizer of the webinar for the extended period of time that they gave me to present it, and I hope to answer your questions later on. Thanks so much.
So thanks very much, Luis. Excellent, and certainly gives us an excellent insight into the process that is taking place in Uruguay. Our next speaker is one of our leading civil society advocates in the Caribbean, Vonetta Nurse. Vonetta is the advocacy officer with the Heart Foundation of Jamaica, and Vonetta will be presenting the experiences of the Heart Foundation of Jamaica in its advocacy for front-of-package labeling in Jamaica. Vonetta, in fact, has many, many years of experience in this area and a wealth of information and expertise to share. And I'm sure we all look forward to Vonetta's presentation. So go right ahead, Vonetta.
Thanks, Jenna. Good morning, everyone. And thank you, Prof. Hassel, and to HCC for allowing us to share our experience here in Jamaica. As some of you may know, the Heart Foundation of Jamaica has embarked on a obesity prevention program, which is aimed at reducing the consumption of sugary drinks through education on the harms of the overconsumption of sugary drinks, as well as it being a risk factor for obesity and NCDs. Our campaign in Jamaica is dubbed "Are You Drinking Yourself Sick? Drink Water Instead." So the project is against the background of the alarming increase in obesity in adults and children in Jamaica and the resulting increase in non-communicable diseases. In fact, in a recent health and lifestyle survey in Jamaica, it was determined that 1 in 2 adults are overweight, and the Global School-Based Student Health Survey done in Jamaica on teenagers aged 13 to 15 actually shows a 68% increase in obesity in the past 7 years. So against this background, we embarked on this project and we have certain policy priorities for sustained gains in obesity prevention. And they are the sugary drinks tax, so a tax on sugary drinks to reduce consumption, marketing of sugary drinks, and overall unhealthy food children, support for a healthy food environment in schools, so healthy nutrition policy in schools, as well as front of package labeling. And we're working very closely with the Ministry of Health and the Bureau of Standards here. And the idea is that, of course, you would have seen the previous presentations where the front of package labeling improves consumer use and understanding, helps them to make healthier choices. And the hope is that there will be a reduction in consumption of sugary drinks in Jamaica and the region as a whole. So the background to food labeling in Jamaica is that you would have heard of the CARICOM Regional Standard for labeling of prepackaged food. So that standard was actually adopted in Jamaica, contains, and it remains in place until the revised version is completed and adopted. So it's general labeling. Okay, so I was saying that Jamaica has adopted the CARICOM Regional Standard for labeling of prepackaged foods, and this was adopted in 2010 and remains in place until the new version has been completed at the regional level and adopted. So the standard includes general labeling requirements we're familiar with, ingredients list, expiration dates, etc. And I'm sorry if it's still low, but I'm having some connectivity issues as well. So I'll do my best. But it includes mandatory labeling, but generally in Jamaica, labeling is mandatory, but nutrition labeling is not. So the standard includes nutrition labeling requirements for the facts panel that you see there, but it's only mandatory where a health or nutrition claim is made. In terms of nutrition label reading and understanding in Jamaica, it's probably the same here as everywhere else, meaning while no formal studies have been published, anecdotally, through our education and awareness efforts, we have found that the general public finds it difficult to read and understand the nutrition facts panel. So the Bureau of Standards Jamaica is responsible for the development of labeling standards in Jamaica, and they're an agency of the Ministry of Industry, Commerce, Agriculture and Fisheries. The development and adoption process of standards, the standard has to be approved by the board of the Bureau of Standards as well as the minister in that particular ministry. The National Labeling Committee on the local level also functions as the mirror committee for the regional level. And so Jamaica's position on the regional committee is formulated on the regional technical committee by the Bureau of Standards. So in terms of our activities at HFJ, we have joined commenting process. We contribute to the overall development of the standard from the local level and contribute to the national position as well. We continue our education and sensitization sessions. So we do a lot of outreach activities. We're also very active on social media, getting persons more aware of nutrition labeling, front of package labeling, and how to read the label. And as well as our advocacy activities with our stakeholders and ministries. And we continue to compile the research evidence in this area so that it's available to the public and our partners. So in Jamaica, there were FOP labeling consultations, I believe, to formulate a national position on the matter before it went to the region. So what we found were industry comments were that FOP labeling would be hard on smaller companies, a cost to rebrand, because of the type of label that was suggested. So the Chilean model was suggested that it may have impact on sales, blacklist products, as well as have trade implications because the USA and the UK don't use this type of label. They use the traffic light label, which Fabio would have mentioned in his presentation. And then there is, of course, a preference for that label because it may be a bit more attractive. So here we are trying to compile the evidence for FOP labeling because we strongly support this type of label warning. The arguments about not being aligned to international partners, in fact, the FOP labeling you would have seen already has been approved in Uruguay and under consideration in quite a few other countries, as well as the codex level. While at the codex level, there is no consensus on the type of labeling, it's important to note that FOP warning labels are being considered. The issue of the USA and the trading partners, both Chile and Brazil, trade extensively with the USA, so import and export of food products. So I believe that especially in Chile, they took a public health decision as it relates to the health of their population in implementing FOP labeling. The Costa rebranding, while no significant studies have been done or that I've seen, it's important to note that in our context, the industry rebrands for special events. So you'll find sporting events or Christmas time or the Easter. So rebranding is available for marketing and other purposes, while our obesity and NCD rates continue to rise. So there has to be a balance as it relates to the cost of healthcare and the cost of profit, which the argument may be substantial in terms of marketing and profits, but the issue of the increasing rates of NCD and the cost on the healthcare system must be considered as well. Dr. Gomez would have mentioned the evidence as it relates to the traffic light labels. So numerous studies have shown that the FOP warning labels are better able to inform consumers on the high content of unhealthy nutrients than the traffic light label. And studies in Chile have shown that the warning labels are effective in shifting consumption behavior as well. So just to show you two articles that were recently published regarding the industry comments on the FOP labeling. So this was published in March 28th, where the Jamaica Manufacturers and Exporters Association raised considerable concerns as it relates to the use of the Chilean front of package labeling. So they mentioned that it would be a trade issue and it would be difficult to implement. And the Bureau of Standards responded to say that a process must be followed in that all stakeholder comments will be considered during the consultative process. And this is the chairman of the Bureau of Standards there, Senator Matthew Samuda. So as we move ahead, we expect that there will continue to be some level of discussion on the matter from both sides. We raised the concern about balance of representation because it's understood, based on what Ms. Priest said, that the committee should be balanced in that we should have representation from academia, health, industry, consumer groups, and it's important to maintain this at the regional process and the local process, even at the board level, at some of the bureaus of standards, for example, to be sure that there's a balance and one group isn't really overweight or, they are. During the mirror committee operations, it's also important that the stakeholder groupings, the voting process is done in a way that one stakeholder group, because of representation or over-representation, isn't able to overrule another in that way. So ensuring that each decision that's made is actually evidence-based and there is a body of evidence for front of package labeling and for label warnings based on the policy priorities. So it's important that the voting and positions come from all stakeholders. We are concerned about the delays in the process, and it's expected that this type, because I've worked in labeling for a while, there will be delays, but given the public health priority, we hope that it will be pushed forward quickly. So as we move forward, we need to consider, well, I would like you to consider our post-campaign evaluation conducted in July 2018 with 1,571 adults in Kingston, in Jamaica, sorry. And that Surveys show that 91% of respondents believe there should be clear label warnings on the front of food and beverage packages to warn consumers when products are high in sugar, fats, or salt. So there's public support here for that priority for front of package labeling. And in closing, I would just say that labeling is a powerful tool used to shift consumer behaviors, not only for marketing, branding, and sales. It's a powerful public health tool to empower consumers to make healthier choices and should be used as such. Thank you.
Okay, to the next one.
So thanks very much, Bonetta. Excellent. And so our next presenter is one of our very own, so to speak, a policy advisor at the HCC, Nicole Foster. Nicole is a lecturer in law at the University of the West Indies. And Nicole will be discussing the trade implications of front of package labeling within the context of CARICOM. Go ahead, Nicole. Thank you.
Thank you, Sir Trevor. And so I'm going to just jump right in the interest of time. And so if we go to that slide. So just quickly to set the context in terms of recognizing that front of pack labeling is a trade issue, bearing in mind that it has market access implications. And from that point of view, it's important to bear in mind that the World Trade Organization does have something to say, or is relevant in this context, insofar as it does have rules that speak to how we would deal with so-called non-tariff barriers to trade, of which front of pack labeling would fall within that category. And the key agreement here is the agreement on technical barriers to trade. And I just wanted to highlight that there is a difference, and there's sometimes confusion between sanitary and phytosanitary measures, and a lot of the standards in the context of Codex speak to this. So sanitary and phytosanitary measures are really measures that are dealing with health, yes, but targeted more at disease, so the pest disease, etc., that come in. Really, when we're talking front of pack labeling, this is squarely a TBT issue, a technical barriers to trade issue. And a technical regulation is defined under the TBT agreement as a document which lays down product characteristics or their related processes and production methods, including the applicable administrative provisions with which compliance is mandatory. It may also include or deal exclusively with terminology, symbols, packaging, marking, or labeling requirements as they apply to a product, process, or production method. And so we see that front of pack labeling is very squarely within the realm of the technical barriers to trade area, and in particular the technical barriers to trade agreement of the World Trade Organization. And this is very much reflected in much of the discourse that has taken place within the WTO, where the Chilean system, the Ecuador system, the Peruvian system, the Uruguay system, these have all been interrogated in the context of the TBT committee. So what then does TBT say in terms of front of pack labeling? What are the key elements that we have to bear in mind and that we have borne in mind as we have tried to develop what we think is the best front of pack option in terms of our overriding concern about the unsustainable levels of childhood obesity, but also obesity and overweight more generally within our populations, and that linkage to our NCD epidemic within the region. Now, the preamble to the TBT agreement itself provides and recognizes members' right to implement measures to protect health. And note, at the level they consider appropriate. I saw a comment in the comments that, you know, WTO prescribes these things for us. WTO does not prescribe these things for us. We determine what is the standard of health that our region thinks is important, that our region subscribes to. And based on that standard, then the WTO says, well, there's certain considerations that you need to take account of as you seek to achieve that overall objective. But the WTO has never and will never prescribe to member states the health policy that they should have. And so that reflected very much in the preamble. And you see there, so it recognizes your right to implement measures to protect health at the level one considers appropriate, provided, and this is where in the way that you need to address it, such in a manner that it is not arbitrary or unjustifiable discrimination or a disguised restriction on international trade. And really, from a WTO perspective, those are the key considerations that health and the standards process more generally has to bear in mind as we move forward with this front-of-pack labeling scheme. Article 2 of the TBT agreement goes on then specifically to provide that technical regulations, of which front-of-pack labeling would be one, are not to be more trade restrictive than necessary to fulfill a legitimate objective. And health, once again, is specifically and explicitly articulated in the agreement as one such legitimate objective. And I thought it is also useful for us to bear in mind that even though we're dealing here with front-of-pack label, there has been extremely useful and powerful analysis of the agreement, and in particular that the approach to health that the WTO is taking in the context of the case that was brought against Australia. And we know that at the end of the day, Australia won that case, and won that case precisely because the panel gave full effect, really, to the legitimacy of the public health objective, even in the context of the World Trade Organization. Next slide. So, if we moving on very quickly to think about what might be some of the trade concerns that may come up in the context of fact labeling. So we may consider, are these things discriminatory? Because of course they have to be non-discriminatory. Well, we know from Fulgence's presentation that the proposed standard is intended to apply to all prepackaged products. So the idea is that we are doing both domestic and imported goods would be subject to this standard. From that regard, from that perspective, we would not be having problems in terms of non-discrimination. The only aspect that we would have to be careful with, and we have seen sometimes some arguments being made about certain exceptions and certain local products, etc., we would have to be very careful in creating exceptions to the standard, because from the time one begins to move away from letting that coverage be as broad as it possibly can, you have to be able to justify those exceptions in terms of rational connection to the policy that we spoke about in terms of providing more informed choices, to allowing us to make more informed choices, and the macro level having an impact on our levels of obesity and weight. Well, there have been some concerns about the negative impact of trade, and from a regional perspective, and as you have heard from Fulgence this morning, this is at the regional level, because the expectation, the hope is that it would be implemented across the board at the national level. So we shouldn't have problems if member states focus on their commitments. We should not have problems at the intra-regional trade level, because basically we should all have essentially the same standard that would be being applied to prepackaged goods as between ourselves in terms of our intra-regional exports. Now, in terms of the concerns about distortions, about different partners having different standards and we create for export, etc., and I saw that there were some comments in the screen about that. Note that, as Uruguay had pointed out, and as they are doing with their standard, it is possible, and our standard speaks to having stickers. So the idea would be that the product comes into the territory, but before it goes on the market, it would the importer would have to assume some responsibility in terms of ensuring that then that product is compliant with what has to go on the shelf. And of course, then our Ministry of Commerce or our standards people would be doing the sort of enforcement from that point of view in terms of making sure that what is on the shelf is consistent with the standard. Fabio and others already averted to the fact that already some of our partners are already going in the region of front-of-pack labeling warning schemes. So we're going to have to make adjustments anyway, because nothing is remaining static in this space as we all try to grapple with this very serious public health threat that is confronting all of us. And even if changes weren't being made, it is also worth bearing in mind that none of our schemes are currently harmonized. So Canada has one scheme, the US has one scheme, the UK has another scheme, and we adjust accordingly, because if we want to export into their markets, we make the adjustments to get into those markets. So it is worth bearing things in mind. If, however, just thinking longer term, if it is that we think perhaps domestic industry might not be willing to deal with stickers and the costs associated with that, and we might not be able to get the exporters to change their packaging because our markets might be too small for them to bother, there may be that potential, maybe, for some domestic production, in the sense that we have seen how Jamaica, for example, in a slightly different context, as they sought to deal with the implementation of the standards in terms of sugary beverages in schools, the industry moved towards reformulation. And similarly, there may be some possibilities there, bearing in mind that the environment has to be available for that to happen, to pick up some of the slack that might be lost there from a domestic point of view. Somebody raised the question of codex in some of the comments, and I wanted to point out that it is recognized that Codex Alimentarius has just started, actually, not very long ago, discussions on front-to-pack labeling. Those discussions are very, very much in the preliminary stage, and they now have a ways to go. If we're talking about getting an international standard in the context of Codex, we're talking about years. And years is something that we just cannot afford, bearing in mind the urgency of the public health threat which is confronting us. In this regard, I also wanted to clarify that even if Codex comes up with a standard, or the fact that Codex is seeking to deal with the issue of front-of-pack labeling, does not prevent or preclude any member state from moving forward with the process. The WTO regime is set up in such a way, the TBT agreement is set up in such a way that if there is an international standard, there is a presumption that your standard is compliant with the WTO regime. However, it's not to say that if your standard is not built, your system is not based on an international standard, that it means you can't take any steps. No, it just means then now you have to do the work and have the analysis and the evidence to substantiate that this is in fact a legitimate public health measure as is recognized by the TBT agreement itself. And finally, just to point out that in fact the discussions in Codex can be influenced and informed and shaped by much of what we're doing here in terms of the front-of-pack labeling. So the two processes can actually support and complement each other and don't have to be in conflict. I'll just skip that slide quickly in the interest of time, just recognizing that there's cost. So the concluding thought that I want to deal with you is, much of the discussion tends to be, is there going to be a cost to trade? And I think, we have to accept and appreciate that with implementation of new regulations, there's always a cost. There's a cost to government, there will be a cost to industry, and maybe that cost passed on to consumers. We don't know exactly. However, to my mind, the more pertinent and important question is not what is the impact on trade? Really, what are the costs? What is the value? What is the importance that Caribbean society, that we as Caribbean citizens attach to health, and in particular to address this problem of obesity? And we saw in Jamaica, we've seen in Barbados that 18% of the population is saying this is a high priority, this is something we're willing to pay increased taxes for, this is something we're willing to pay for. And really that is the source that we have to have in terms of the governments at the end of the day have to make determination of where they strike the balance between trade industry more broadly and health on the other. And it's really only governments that can make that call. But at the end of the day, that call has to be one that is balanced and informed one that takes account of the scale and long-term economic impact of the region, the epidemic, also minimizes any problem in terms of our existing international trade and international obligations. For example, like I said, when we're seeking to put in place exceptions, to the extent that we do, we would have to be conscious of those things. So that quickly is a slide based comments that came in to integrate some of the comments into my presentation, and I leave this.
So thanks very much, Nicole. That's really excellent. And as you were speaking, I was thinking to myself that your excellent presentation, providing such good information, reflects very well a part of the title of this webinar that speaks to pushing and pulling. I now would like to invite Maisha Hutton. Maisha is the Executive Director of the HCC, who will share some of HCC's advocacy work and next steps. Maisha?
Hi, everyone. It's a pleasure to have hosted this webinar. A lot of effort has gone into it, and we're really excited to have had the speakers and the excellent information they provided. So in wrapping up, I had a few slides. I don't see them up yet, but I'm just going to quickly summarize the work that HCC has been doing in partnership with all of our colleagues across the region, PAHO, CARICOM, CARFA, et cetera, and really trying to move this agenda forward. And of course, working closely with CROSQ and our members at the national level, such as the Heart Foundation with Vanetta. So firstly, HCC is a member of the CCHD, which is the PAHO-led Chile team, which works in sharing experiences from Chile and translating them in the region. And we are also, we've also been monitoring the process. Let me move to the next slide here. Right, so we've also been building regional stakeholder, a network of FOPL CSO stakeholder advocates, really trying to tap into country contacts and build a network of individuals who will be effective advocates within the national processes that Fulgence would have described earlier in his presentation. We've been working to provide intelligence and support so that they can participate in these consultations. An example of that are documents around what fronted packages, why it's so important, and what are the critical industry arguments that are going to be raised, and how do they respond to those arguments effectively. We've also been monitoring the process at national level to ensure that there's transparency and accountability as it relates to how the process should be operating, so that we have maximum input from diverse stakeholders, and our public health advocates are now not drowned out by the private sector actors who are the usual individuals engaged in these processes. We're hosting this webinar as part of the public education and educating our advocates, and also informing other key stakeholders from the public sector and the private sector. And we're also working on developing a number of graphics and PSAs to educate our various stakeholders. And this is, the next slide is an example of some of the graphics that we're working on right now that we will be disseminating through our channels and through the channels of our partners. So that's just a quick taste of what the HCC is doing, and we're now going to segue into our question and answer period.
So thanks very much. And at this stage, what we would like to do is to invite Juanita James of the Antigua and Barbuda Diabetes Association to briefly share with us what the local CROSQ process has been like from her perspective. So if you could go right ahead, Juanita. We're not sure if the technical aspects, but go ahead, Juanita. So we're not hearing you. We're not hearing Juanita. So we'll now go into the moderated question and answer session. And let me say that we've had an outstanding number of persons attending this webinar, and during the process, we have received a significant number of questions. And among those on the webinar, there's been a lot of discussions also taking place in the chat room. One of the questions that was posed was, what has been industry's response, and how what's the plan to address conflict of interest in policy development? I don't know, Fulgence, if you're still there. I don't know, perhaps you might like to address that specific question. What has been industry's response, and how do you plan to address conflict of interest?
Thank you, Doc. I would have indicated that the comments on the standard have been tremendous, voluminous, most of it coming from industry, right? The greatest challenge being posed by industry is the fact that acceptance of the warning label, as opposed to various other systems like the traffic lights being employed by the UK and the US, and as Fonetta would have indicated, indicating that these are trading partners and whatnot. Let me just indicate here that the National Standards Bureaus, who are part and parcel of conducting this exercise, as well as CROSQ Secretariat, we are not subject matter experts, and so we depend on the technical committee members who are the ones who decide on the content of the standard. The way we approach the comments from the stakeholders is to be able to arm the technical committee with the necessary evidence and information so that they could make informed decisions. Yeah, and so it would be a situation where we would have to continuously talk to industry. And as you would have realized, in my recommendations, I'm asking at the national level that health and commerce trade sit down together and discuss the issues, take in consideration private sector and everybody. Sit down and discuss the issues, show them the evidence, show the fact that it is not necessary that we have a similar standard with the UK and the US, right? In standards development, right? Yes, you try to achieve the standards set by your trading partners. However, it does not mean that your standard that you operate by cannot be higher than what is prescribed by your trading partner. And in this case, this is such a case, an example. And so your trading partner will not reject your products and services because you have a different standard. It's only if your standard is lower in terms of the requirements than what they have set for their products and services. And so that should not be a case where should not be a problem. And this is what we're trying to let the industry understand. Give them the information, show them the evidence that is there, right? And to get them to consider positively the front of packet warning label. So in instances, they're saying they're not against a front of package label, but they're against the fact that we are proposing a warning label.
Excellent.
Right? So it's cohesion, speaking, the conversation has to continue until they understand and we get positive results.
Excellent. And I believe, Luis, you wanted to make a response as well, so please go right ahead.
Yes, thank you, Sir Trevor. So I think I misplaced one of my slides during the presentation that addresses specifically these issues. So Some of the barriers for implementation that we have here in Uruguay is that the industry, of course, has been opposing this regulation from the beginning of the discussions on the intersectoral group. Right now that the regulation has been approved, there are two administrative actions presented by the national industry, one that was presented by one single industry and one by a group of industries. And as for the Beatriz Champagne comment, Ministry of Health in Uruguay is very well on board, as well as the Ministry of Industry. But the trade sectors of Argentina and Paraguay, and I mean the governmental trade sectors, have presented objections in Mercosur regarding the regulation. And that's why Uruguay requested to begin the discussion of a regional technical regulation on front of packs labeling. Also during the public consultation in 2017 and after the notification to the World Trade Organization on the approval of the decree, we had an enormous amount of comments coming from both governments, but specifically from the industry, again, opposing the regulation. So also Brazil sent several questions regarding the regulation directly and through the TBT committee. And there was a specific trade concern raised by Colombia in the TBT committee of the WTO that was also supported by Argentina, Costa Rica, the European Union, Guatemala, and USA. This concern was initially withdrew by Colombia after a bilateral meeting, but there are some questions still to be answered on the WTO. So there's much I would say, opposition from industry to this regulation, and we're trying to reply to all their questions and the evidence that has been created here in Uruguay to support this regulation. Thank you.
Thanks very much. So I believe, Vanetta, you wanted to make an intervention as well, so go right ahead. And also, Juanita, I think you wanted to make an intervention. Juanita, could you unmute your mic and speak? Okay, so Nicole, perhaps you'd like to ask your question or make your intervention.
Trevor, just quickly wanted to follow up in terms of the comments from Uruguay and the other comments, just to highlight two things. One is the critical importance of evidence. So we have to ensure, and of course our partners like CDRC, at UE, etc., are key in this regard. We have to ensure that we have the evidence to support the policies that we're doing. And it's good to have international evidence and regional evidence more broadly, but it's even better if we have local specific evidence to substantiate the claims that we are making. And so I wanted to highlight that as one thing. And that leads to the other comment, which is in terms of, because evidence then becomes key in the context of addressing the concerns, the specific trade concerns as they're called, within the WTO in the TBT committee. Because you're going to have to be able, in the absence of an international standard, which we don't have, you have to be able to substantiate that there's an evidence that, you know, that this is not just something you pulled out of thin air. So I just wanted to highlight that is so important, and we have to ensure as we go along that we continue to collect the evidence as we have been doing in terms of levels of obesity, linkages, all of those things, because that is really going to be the core of what we have to rely on in justifying these regimes in the context of dealing with our partners more broadly, but specifically in the context of the World Trade Organization.
So thanks very much. And we've got, as I said, a very long list of very, very, very rich questions, and this is really a very, very rich discussion. So these next two questions are for Fabio, and one is the issue of sweeteners. I don't know if you'd like to address that in the general, because concerns have been expressed as far as that issue is concerned. And the other issues, our question has been raised, which is, has any small state with net food import from countries without a mandatory front-of-package labeling system successfully implemented the high-end front-of-package labeling? And if so, what are some of the learnings and the challenges and the best practice? So one relates to the issue of sweeteners, and the other to the issue of small states with high net food imports. Fabio, are you there? If so, please go ahead and respond.
Yeah, yes, sure. Thank you. Yeah, so in the case of the question about the reduction of sugar driving concerns with the use of sweeteners, so there are some countries that have also front-of-pack information on the presence of sweeteners. So yes, this is something that countries can consider, bringing that information to the front of the pack, and so that the consumers is clearly and easily informed about the presence of sweeteners. In countries that have been restricting reducing the sugar content, there's also been monitoring of the amount of sweeteners that has been. So right now in Chile, they're monitoring how the sweeteners are moving, and checking what will be the issues related to that. So yes, I think that's something that countries should consider. They should keep monitoring, and the best approach is, of course, to reduce the amount and the levels of sweetness that we are, especially in ultra processed products, they're bringing children to, for instance, away from fruits or any other products that are naturally sweet already. So this is something of that countries are being monitoring and taking actions, and not necessarily all the actions will be done through the front of pack labeling. So this is important. So there's some that you could do, like adding an information on the front of the pack of the presence of sweeteners, but there's also other measures and policies that countries and guidelines that countries can use to restrict the use of sweeteners on the diets of the population. So yes, this is important to be considered. On the small states experience, I think we have an almost small state with the experience from Uruguay. So I was looking into the numbers from Uruguay and Jamaica, just to give one example, and then they're not that far from each other, especially, you know, as Luis mentioned, how Uruguay is placed in between two very, very big countries. But in any case, as you mentioned, as you saw, the experience in Uruguay is not technically a small state, has been a thorough process, and I think Luis explained very well how it's been played, and how they manage with the challenges and got it approved, and the implementation and monitoring systems are now being put in place. Having said that, I think one of the things that we have to keep in mind is that when we're looking into experiences and we're looking into the evidence, there's always someone that will start and get started with the first initiatives, and of course bringing from the experiences from other contexts. So if we don't have any experience from a small state, so that the Caribbean should be the first one inspiring the world, and I think the whole world is watching the Caribbean now as a region that could, and that has the the chance to show the world how to implement that and protect the health of the population and improving their diet. Thank you.
Thanks very much, Fabi. So a very, very specific question, but a very important one, Fulgence, for you, and that is, where can the public go to see their country's national position? I think this is a very, very important question.
And how the comments are disclosed.
Thank you. I was just in the process of responding to that question in the chat.
Right.
Really, once the process of disposition of comments have been completed, the disposition sheets will be submitted to the member states through the NSBs, and it will be disseminated to all stakeholders on the national level. Usually the NSBs also publish the comments on their website, and we would do the same on the CROSQ website. So every member state, everybody will be able to see comments submitted by their member states, as well as comments submitted by all the other member states, and how these comments were addressed. This is very important to us because that's part of the transparency process. Yeah, and so it will be published on the websites of the various NSBs and on the CROSQ website as well.
Okay, and Fulgence, not surprisingly, many of the questions are directed at and for you. And here's another. Many products are made by cottage industries, that is small business personnel. Many of these products are high in sugar and or salt. Will they be required to comply with the standards? So it's the question of cottage industries and small business personnel. Will they be required to comply with the standards?
I think in Nicole's presentation that she would have indicated there is the question of non-discrimination, and so in the process of implementation of standards, right, whatever that pertains to external parties must obtain to national as well, right? And so it means that everybody would be subjected to the same standard. Yeah, what in implementing the requirements of the standard, remember, just a thing is that standards are voluntary documents, yeah, and they will remain voluntary. However, the requirements of the standards can be made mandatory through a technical regulation, which Nicole would have spoken to about before, right? And so in the implementation of the requirements of the standard, right, the governments might decide to give an implementation period by which then a grace period that everybody will be able to conform by a particular time. And so these things will be taken into consideration in the implementation of the requirements of the standard.
Okay, so thanks very much, Fulgence. So perhaps this is for Nicole. Would a regulatory impact assessment be necessary for justification to show compliance with TBT agreement, or will it be a legitimate purpose of the objective to be adequate?
Okay, so just quickly, so the idea is, in the context of the TBT agreement, you are allowed, as I said, to take measures that are in public health, in the interest of public health. But obviously, as I said, if you don't have an international standard which sort of gives you that automatic waive in, where you know there's no problem with the TBT agreement, you have to substantiate it. And so the more evidence you have, the better. So I don't know, I can't say to you that you have to have a regulatory assessment, but certainly that would make sense in this in the sense of tracking what, in the same way that you have seen that Chile has done, for example. So Chile has implemented this system, but an important part of implementation has been monitoring and evaluation, so that when anybody asks them a question, they're able to say, well, I can show that, for example, the really startling statistics that Fabio referenced about a 90-something% change in decision and purchasing. So if we say that the impact, the objective of this measure is the impact on help consumers make more informed choices, well, that's a slam dunk. But if they hadn't done that evidence, you can't just come in the committee and say, we believe, we believe. You have to have evidence to support it. And that's why I reference, and I really encourage everybody who has an interest in this area to look at the plain packaging case, because that is key. You really see how Uruguay was really excellent in terms of the work that they did in that regard. They were the first, and it comes back to something Fabio was saying as well. Sometimes you're the first to do something. So in Uruguay's case, they were the first to implement some of those types of plain packaging mechanisms for tobacco. And so they didn't necessarily have all the evidence in place, but they had something, and then they were able to draw on other things by analogy, etc. So it's really, that's a great case to show you the different levels and types of evidence that you can use and support the arguments you make. But the bottom line is that evidence is key. So you will not be able to go into the WTO and just say, we introduced this in good faith, believe us, this is not about protecting trade or being creating a barrier to trade, this is about health. You have to be able to substantiate, one, that there's a health problem, two, that the measure in question is going to make a contribution towards that health problem and is linked to the policy objectives that you have. And here we're talking not about revolutionizing the world, but simply about allowing consumers to be able to make more informed choices.
Come in here, Professor Hassel. If you would realize in my presentation, I would have said that implementation at a national level and member states have to adopt them, what the case may be. I also indicated in doing the regulation that it should be that good regulatory practices should be followed. And one of the things in good regulatory practices is to do an RIE. Yeah, and so it would be recommended that member states do a regulatory impact assessment before implementing the action. Yeah, and so that it could be seen and everybody would be engaged, right? And it will be seen that the action being recommended is the necessary one. Yeah, so it would be advisable that an RIA be done in the before the implementation of the measure at a national level.
Okay, thanks very much. And so perhaps we're getting near to the end of our question and answer period. And this question speaks to the fact that the thresholds implemented in Uruguay allow more incentives for reformulation compared with current proposed thresholds. And so the issue was raised as to whether a phased-in approach might be something to have a look at. And I wondered, Fabio, if you might respond to that whole issue of a phased-in approach.
Sure. So one important thing is that countries, as Nicole rightly mentioned, they have a justification for their criteria and a technical justification for the products that they're gonna consider high end. So if they have and if they start to change those values in ways that are not based on recommendations, then it becomes hard for them to justify those different numbers. So in some countries, they've used a different phase of the rigorosity, but the final criteria and the aimed criteria is the one that is based on the recommendation. So but in this case, what I understand is that when we're speaking about the standard and the sub-regional standard, and I think it would be good to hear from Fulgence, you want to have the what is the recommended criteria that you have, because this is the standard for all countries. And and then you can just give time and change and give time for them to achieve and to apply that. And it doesn't mean that you're prohibiting. And again, we're not saying, and this criteria is not to remove the products from the market, is simply to inform consumers if that product is high in such product. So it's we're just giving an information for consumers. So some countries have changed the criteria until it gets to the definite criteria it's going to use, and some countries have used just the time. The problem with giving the different thresholds throughout the time is that you're saying at some point that a product is high in, and then and that you're saying, and you're not saying that some products are not. You're saying that some products are not high in right now, and then you at a given point you start to say that those products are now high in. So you may have a problem when you have this phasing out in terms of rigorosity. So ideally, you just give time and you inform exactly how it is. But some countries have taken a different decision on that, and they have phased out. And I think Luis and Fulgence, Luis could mention the case of Uruguay, and I understand that from a national perspective, you have to have the standard. You have to have the criteria, which is based on recommendation. Then how countries will implement that, it may change. But I would leave to Fulgence to comment and to Luis as well. Thank you.
Okay, so intention, if I come in here, the intention really, what we would have looked at in terms of the criteria and select the model, you would have had WHO recommendation, right? And the recommendation is that this is the recommended intake of the various nutrients to so that you don't have an onset of NCDs and obesity. And so what is the objective? Is the objective to just reduce the consumption of sugar, which will not actually reduce the incidence of NCDs? So if the objective is to reduce the incidence of NCDs, you need to be able to achieve the WHO recommended values. And so we would have used the PAHO nutrient model to achieve that. Yeah, and it's about achieving the objective that is set, the policy objective, right? And so here's the reason why phased implementation in terms of different levels will not work. And Fabio is correct. At one point you're saying that that product is not high in, and at another point you're going to see that product is high in. It just wouldn't work. So the fact is that you set your level. Anything above that, right, means it's high in, and you put yourself, the public, at risk of the onset of various NCDs. And so that's what you want to reduce. So you need to be able to stick to the criteria used, whether you give 5 years, right, to get to that, right? You're going to implement in 5 years, you state you're going to implement in 5 years. But after the 5th year, you know everybody has to conform. And that's the intention, really.
Thank you very much. I think we'll give the last opportunity to speak to Luis. Luis, you wanted to respond?
Yeah, sure. Thank you, Sir Trevor. In the case of Uruguay, the CRE doesn't foresee a phasing out process. We only determine those the levels that are currently implemented, and we expect, as I mentioned during my presentation, that the Parliament discusses and approves a bill and a future act regarding front of package labeling, and we expect to modify those current thresholds during the regulation of that law. So we are currently don't have an expected timeline to change the current thresholds, and we expect to do it once the Parliament has approved the law. If not, the next government will have to decide when to do that. And one of the reasons we modified the thresholds was specifically for the issues raised by the industry in terms of that this timeline and change thresholds will allow them to reformulate many of their products. So far, we've had no communication from them on whether they had or not reformulated their products. So we are expecting for the full entry into force of the regulation in order to check if that was effectively done. But so that's the history here in Uruguay. Thanks so much.
It only now remains for me to thank everyone. First of all, let me start by thanking the presenters, all of whom provided us with a tremendous amount of significant and very, very, very positive information. I'd like to thank all of you who attended. We're now some half an hour after our intended close-off time, and we've still got several persons still in attendance and chatting away merrily in the chat room. And what that is saying to the HCC is that this is clearly a highly important topic. We in the HCC would like to congratulate particularly CROSQ and the leadership of CROSQ for the excellent initiative and the professionalism with which they're conducting this work in direct response to the mandate of the heads of government of CARICOM. It is our intention to make the slides of the presentations available to all those who participated. The webinar has been recorded, and so we will certainly be following up with you in one way or another, as essentially we seek to address an issue that certainly all of us in the Caribbean are totally committed to, which is one of contributing to our Caribbean people being healthier. And so with that, thanks very much once again to everyone. Bye.